welcome to our pharmacology unit. My name is Eduardo, and I'm going to help explain the entire 4 lessons associated with this unit. So, our first lesson is the pill identification chart. In this lesson, the students will be able to read a pill bottle and also the pill instructions, either on the box or on the bottle itself. So, our materials are going to be laminated medication handouts and a regular handout that has a chart. Before we begin any of this, I'd say you should take the pretest. This pretest lets the students input their information and you can find out whether or how much information they know about pharmacology. So, for the preparation, I'd recommend that you highlight the terms that you're going to be using for the pill identification chart. Scientists use the pill identification charts to categorize what the pills do. They categorize them into different methods so that they can know exactly what they're used for, and it also tells them apart. So a pill might be a different color, size, shape, and this helps the scientists categorize them. Again, different pills have different strengths, dosages, and frequencies. So these terms can be identified. They can be identified and differentiated. So it's important that the students understand that a prescription is only made for one person depending on their age, height, and weight, and their symptoms. So a prescription should not be taken by anyone else. Once you're done with this vocabulary and the students understand what a prescription is, we can move on to an active ingredient. An active ingredient is what makes the pill work. It relieves your symptoms, and this is the main one that helps you when you take the medicine. A dosage is how much of a medicine you're allowed to take. If you take too little, it isn't working. If you take too much, you can get really sick, or you can even die. Again, it's really important that the students know what a dosage is. Strength is how strong the medicine is. So some medicine may be stronger than others, such as prescription. You can get a prescription pain reliever at 500 milligrams versus, let's say, an ibuprofen that's 200 milligrams. It all depends on the kind of medicine you're taking and what you have. Then you have strength frequency. Frequency is how often you're allowed to take a medicine. So again, going back to the laminated sheets, there's a lot of wording on these, so I'd recommend that you highlight the terms before during your preparation hours. So right here on JARC you can see the dosage. Again, the dosage is how much you're allowed to take. Your dosage is limited to 3 caplets, so you can highlight this. Your medication strength is right here. It can be measured in 220 milligrams. And your frequency, you're allowed to take 1 pill every 8 to 12 hours. And if you look for the active ingredients on this, you can find it. So the 2 active ingredients are naproxen sodium. It is also found right here. You can highlight this so that the students can understand and see what exactly they're looking for. It is the student's responsibility to see which one is the dosage, frequency, active ingredient, and the strength. They're going to do this for all of the medicine. It's okay if they don't get through all of them, but as long as they get some written down on their chart, that's all that matters. That they can identify and distinguish what strength, dosage, and frequency. And because these are, they're boxes, they're not really pills, they can make up a shape or a color or a size. Again, it's important that the students understand that these charts are made so that doctors know what kind of medicine they're using and what kind of medicine they should look for. That is the conclusion of Lesson 1 of Pharmacology. And thank you.